how you diagnose this autism or any problem related to developmental disorders? I'm giving a broader spectrum.
Excellent question. And I'd again like to go back to something previously that you said, and then I'll come to what you have said just now, is that the reluctance in many families is around stigma. Because we are very scared in our society to say my child is different in any kind of way, because there is a lot of discrimination. We use terrible words to describe children and people who have a difference. And that is really where many families will have a reluctance to seek help. When they seek help, often what happens, and I think this is really important for families to understand, you said this earlier, this is not a cough, this is not a cold, this is not diarrhea. This is going to require time by the doctor to come to a proper conclusion. Of course, there are some disabilities which we can detect very early. So supposing you have a child who is not holding their head properly by 9 to 10 months, a child who by 18 months is not walking, a child who is got no speech, at 18 months, a doctor will very quickly be able to tell, something is wrong, please go seek help. But for things like autism, we have certain tools. So we have certain checklists. We do observations on the child. So we ask the child to play with toys in a certain way. We ask them certain questions. We look at their responses. So this is a very important assessment that takes place, and it takes time. So parents must be not only patient with the assessment, but then I would say also patient with therapies, because these also take time. A child who has not been developing in the right trajectory or in the right way will require time to put them back on track. Absolutely. And that is what you talked about, which was early intervention. That how do we get them interventions early? Absolutely.